My name is Eva Fath, and today I'll be giving you a presentation about heroin addiction. So first I'm just going to pose some pre-assessment questions. Number 1, true or false? Does heroin come from a plant? Number 2, is injection the only method of using heroin? Number 3, what should you do if someone is overdosing on heroin? So are there special steps that need to be followed in order to save that person? Number 4, is drug addiction considered a disease? And lastly, true or false? Are there methods that can be used in order to prevent substance abuse? So to begin, I'm just going to talk about heroin, the basics of it. So heroin is a man-made substance, but it does come from a plant. It comes from an opium poppy seed plant. The resin of the middle of the plant is made, and that makes heroin, or is extracted and makes heroin. So heroin usually appears as a brown or white powder, but the most common that has been seen over the past few years is the black tar heroin, which is a black sticky substance. Heroin can either be injected, smoked, or snorted, although injection and smoking is the most common method of using this drug. Usually people also mix heroin with other drugs. Usually it's crack cocaine, and they call that speedballing, so it's a very common thing that a lot of people do. Heroin is also very, very common in the homelessness population. It's usually homeless people's drug of choice. So now we're going to talk about some effects of using heroin. When you first use heroin, it instantly enters your brain and it binds to opioid cell receptors that are in the pleasure and pain parts of your brain. So it binds to those receptors and it causes this very, very euphoric rush of a feeling that people feel no pain, they don't feel anything, they're just happy, numb, kind of. And those effects last for immediately 10 minutes, I would say, and then there's other effects that aren't so intense that last for hours after use. But people do sometimes use one or more fixes for a day. So heroin has been growing very significantly over the past few years because it's very, very accessible, and it's also very, very cheap. Black tar heroin is the choice of the type of heroin. Nowadays, it's been growing very, very popularly. Usually people begin using heroin, before that they start using other painkillers such as Vicodin, Oxycontin, Percocets, things like that, and sometimes they're stolen from family or friends or if someone's prescribed them after some type of surgery. So people know when it comes to heroin there are great significant body effects. Some short-term effects: dry mouth, warm flushing of the skin, just pain, heavy feeling in your arms and legs, nausea, vomiting, severe itching. People get paranoid and think there's bugs under their skin when they don't have their fix for the day and they begin to itch. Just clouded mental functioning overall. A lot of drug addicts, you see them kind of wavering back and forth or nodding their head, and that's kind of like the state of being semi-conscious, so they're kind of just not all there. Some long-term effects: insomnia, collapsed veins for people that inject the drug, so if you keep using a vein over and over again, it can collapse or get a knot or a blood clot in it. Some damaged tissues inside the nose. If people snort it, the inner lining of your nose just becomes deteriorated. Infection of the heart lining and valves, abscesses, constipation, stomach cramping, liver and kidney disease. Mental disorders can arise before or after drug use, like depression, anxiety, ADD, ADHD, post-traumatic stress disorder. Men can experience sexual dysfunctioning, and women can have irregular menstrual cycles. And also, if you inject heroin, there's a chance that you could obtain HIV or hepatitis from shared needles. So overdosing is a very common component of heroin use. Overdosing occurs because of the lack of oxygen that gets to the brain, which is referred to as hypoxia. So this can also cause permanent nervous system and brain damage, so someone that overdoses may not come back completely 100%. This thing of overdosing has grown so significantly over the past few years because of the opioid crisis that began in 2017. Almost 50,000 people died because of manufactured fentanyl. Fentanyl is a synthetic opioid that is made, and if just too much of an amount is in there, it can be lethal and stop someone's heart. To stop an overdose, there is things that you can do. So there is a medication that goes by the name of naloxone, and it comes in 3 different forms. It comes in a nasal spray, which is the most common, referred to as Narcan. So there's a nasal spray, an auto handheld injector, and an injection that can be administered. Naloxone is carried by all medical professionals, EMTs, firefighters, police officers, just in case So if you do witness someone that's overdosing, just tilt their chin up so you can open their airway. Feel for a heartbeat or breathing. If there is no heartbeat present, then begin CPR immediately and just wait until medical professionals show up. Narcan or naloxone is also provided to friends and families that are at risk for an overdose themselves, or if they have someone in their family or a friend group that's using drugs. So if naloxone or Narcan is present, then administer that to a person that's overdosing as well. So now we're going to talk about substance use disorder. Substance use disorder, in short words, is drug addiction. So this, according to the National Institute of Drug Abuse, it is considered when the continued use of drugs causes issues and health problems, failure to meet responsibilities, school, work, friends, family life. So this usually can occur from people that have other underlying mental issues such as anxiety, depression, ADD, post-traumatic stress, schizophrenia, things like that. Sometimes people cope with drugs and it just escalates, and that can be very, very harmful to those underlying issues as well. Drugs do not for sure make them better at all. So there are stages of substance use disorder, first being experimental use. So that might just be a social thing that people are doing with friends, a social gathering, kind of trying to fit in, just maybe trying a drug or so. Then it moves on to regular use, which can entail when someone may be using a drug for their own pleasure, on their own time, not with family or friends. So that can start to create a distance or separation between family and friends, work life, school, other daily activities that they enjoy. Then it becomes problem or risky use, and that is when they begin distancing themselves greatly. They start to prioritize their drug use over other things. People may be out of a job at this point, fired, laid off, or even homeless. They might lose their house, and they don't have friends or family to turn to. And then the last stage would be addiction. That is when their drug use is prioritized over everything in their daily lives. They could be homeless at this point, have no supporting friends or family, and this is when treatment would come into play. So addiction would be the last step. So there is treatment for drug addiction. Usually this entails medical professionals used as psychiatrists or doctors or therapists. There's three basic treatment options. The first being medication-assisted treatment. So that's when they will use medications to curb those craving dependencies that they used to depend on with drugs. So they are medicated with other medications too to keep the other medical issue or mental illnesses such as depression and anxiety, all those other things, they can be medicated for that as well. The second being cognitive behavioral therapy. So this is more one-on-one, sit down with a therapist or psychiatrist and talk about behavioral and lifestyle changes that can be adjusted in order to prevent relapsing and using drugs again. And the last one would be medical detox. So this is more focused on the stage of when someone is fresh off drugs and they're going through the withdrawal stages. This is very significant because they're supervised at all times because they can be a harm to themselves or others. People can do crazy things when they're in those withdrawal stages and trying to detox from using drugs for so long. During these treatments, a lot of underlying issues, like I said, post-traumatic stress disorder, schizophrenia, sometimes eating disorders, depression in general, just all those other mental illnesses that people can be diagnosed with when they're in treatment, and that can either be prior to drug use or after drug use. But for specifically, for heroin users, there is methadone clinics. Methadone clinics are a form of medication-assisted treatments. Methadone is a drug, another opioid that is administered. It's not as intense as heroin, but it does satisfy those cravings as a drug addict would have. So the only downside of methadone clinics, there's been a significant increase in overdoses and addiction to methadone because people will stop using heroin and then get addicted to these painkillers. So as we talked about the addiction side of methadone that's increasing, that also can deal with relapse. So about 40 to 60% of drug users say that they relapse within the first year of recovery. So relapse is a very, very common thing with drug addiction. Family and friends should try and push a person to seek treatment as much as necessary, even if they relapse multiple times. So methadone clinics, since the addictive properties of it are increasing, doctors have noticed this, and they use a process now by the name of induction, and they monitor their dosages for their clients, and they slowly kind of wean them off of them. Some negative side effects of being addicted to methadone: lightheaded, slow or labored breathing, chest pain, rapid heartbeat, muscle tremors, muscle cramps. So some people might experience this, but the methadone does help with cognitive behavioral therapy as well. It kind of satisfies those cravings that heroin once gave a drug addict. And so now we're going to talk about prevention of substance abuse. So there are ways that you can prevent substance abuse, one being drug education programs. I personally remember throughout elementary, middle, and high school, we had drug education programs come to our school and speak about it. One of the most common ones is DARE, and another one is Truth. I've seen Truth post a lot of advertisements, commercials for vaping and opioid dependence, so it's very common. Another way to prevent is avoiding harmful environments, whether that be friend environments or family environments. This is key during adolescence. Adolescents are encouraged to be involved in some type of sport or activity, so they don't have a lot of free time to hang out with the wrong crowd. Peer pressure is a big component of adolescence, and a lot of people will do things just to fit in, so having a good role model, teachers, parents, is a good way to help out. Another way to prevent substance abuse would be to only take prescribed medications, painkillers like Percocet or Vicodin, maybe after surgery. Take them only if needed, and also it's helpful to have someone monitor your dosages, keep them out of reach of someone that may be tempted to take them. Majority of drug users say that their addiction began with stealing prescriptions from friends or family, or having a prescription themselves after a surgery and getting addicted to them. And if you or a loved one is suffering with any type of drug addiction, please, there are several hotlines that you can call in order to find help, find treatment centers, rehabs close to you, and try to figure out if your insurances can be accepted, or just talk about how to maybe help someone that has a drug addiction. So this would be an activity that I would do if we were in a classroom setting. I would have the students get in groups of like 3 or 4, and advertisement is a great tool to try and get their point across about substance abuse. So some of these examples on the slide are some great examples of how to get someone's attention and kind of educate themselves about substance abuse or heroin specifically. So I would just get in some groups of 3 or 4 students and create a flyer that has an attention-grabbing picture, kind of make it creative in your own way, and we would get in groups and talk about their flyers. Okay, and lastly, I'm going to go ahead and answer the post-assessment questions. So first, does heroin come from a plant? That is true. Heroin does come from a plant. Remember, it is the opium poppy seed plant. Secondly, is injection the only method of using heroin? That's false. It can either be smoked, injected, or snorted, but smoking and injecting is the most common. Thirdly, what should you do if someone's overdosing on heroin? Remember, immediately call 911. Lift their chin up to open their airway, and if Narcan or naloxone is available, administer that, or perform CPR if needed until medical professionals show up. Fourthly, is drug addiction a disease? Remember, it is considered a disease. Substance use disorder is the name of it, and people really do struggle with it. And lastly, true or false, there are methods that can be used in order to prevent substance abuse. So we just talked about these. There's the drug education programs, being in a good environment, family or friends environment, and also just only taking prescriptions as needed or not at all. And there are my references. Thank you so much for watching, guys. Have a good day.